Hey guys, welcome to Fortitude's Training Tip Tuesday. I am Dan North, and today we're going to talk about something that I think a lot of people deal with, not just athletes, but a lot of general gym goers as well. Let's say you're a bodybuilder, weightlifter, powerlifter, you do CrossFit, or let's say you just go to the gym, just looking to get healthy. A lot of us deal with chronic knee pain, and that is something that can interfere with not just our everyday life, but our performance in the gym as well, especially if we're doing specific sports such as weightlifting and powerlifting that involve movements that involve a lot of high impact on the knees and require reflexive movements and springing up from a squat or catching a clean or a snatch. Today we're going to talk about two main strategies that can help your chronic knee pain. The first key area that we're going to work on is mobility, particularly mobility within the ankles. Our ankles have to be able to bend a certain amount in order to be able to get into an optimal position when performing movements such as squats, deadlifts, lunges, and other lower body dominant movements. If we have limited range of motion in our ankles and limited flexion ability in our ankles, rather than getting into an optimal position where we're able to recruit our hamstrings, our quads, and our glutes, and some of our other supportive muscle groups, a lot of that pressure goes to the top of our knee, particularly our patellar tendon, which runs along the front of the knee. I'm going to show you guys some strategies that I use for myself and with my clients to alleviate that knee pain and make sure that you're able to perform better in and out of the gym. So in order to get better ankle range of motion, there are a couple of strategies that you can use. The first one that we're going to do, I'll have some video overlay as I'm talking. We're going to do what's called a kettlebell hang. Hold a kettlebell, set yourself up on a riser, whether it's a bench or let's say a block, whatever you got at your disposal at your gym or even at home, depending on where you work out, where you train. All you're gonna do, hold a kettlebell, that same side that you're holding the kettlebell, that foot is gonna be hanging off of the edge with the heel being dropped down. You're gonna feel an extension, a pull in the back of the calf muscles, the gastroc and the soleus. Depending on what angle your foot is, you can alter the angle. All you want to do is just hold that position for, let's say, a 45 to 60 second count until you switch sides. Just go by feel and go as long as you feel the tension release. The second one that we're going to do for the ankles is a banded dorsiflexion stretch. To get a mobility band, I like the green strength bands. I find that's a good tension to use for most mobility drills, but depending on what you have at your gym, just grab what you have at your disposal, and anyone should work fine if this is your first time, but I would definitely recommend getting a green strength or mobility band. Tie it through a squat rack, get it supported whatever you have. You're gonna put your foot in. You want that band to be set up on the front of the instep of your foot or the front of the ankle. Now you can do this a couple of ways. You can do this from either the floor, or you could have your foot set up on top of a box. Have your foot in the band, whatever foot's in the band. Let's say you're doing it from the floor. You're gonna kick that foot forward so there's good tension already created on the band. You're gonna feel the band wanna pull your foot back. You wanna step with your other foot on top of both ends of the band. Get down into a squatted position, keeping that lead foot flat on the floor. And you want to push that knee forward so you're feeling a pull from the band along the front of your ankle. That's going to increase the range of motion in your dorsiflexion. And again, your ankle needs to be able to bend that way anyways to be able to get into an optimal squat or deadlift position or other athletic positions. So without that optimal range of motion in the ankle, if you try to get into a squat position or other athletic positions, that pressure is going to go along the front of the knee, which is not what we want. The second way you can do this is to do a banded dorsiflexion stretch along the top of a box or a riser. This is a little bit of an easier position to get into than the floor. So the floor would be a progression from this movement. Same idea, but you want the band set a little bit higher so it's the same height as the box or riser that you're using. because you want the band to be perfectly perpendicular to where your ankle is situated, so the band is pulling you back. So set it up however high the box is, get your foot up on the riser. Again, same principles apply. Keep your foot flat, kick it forward so there's good tension created on the band, and you should feel that pull being created before you even get into the stretch. Push that knee forward, hang out in that position however long it takes for you to start feeling some tension begin to release, and then you can switch sides. Definitely recommend doing this before any squat days or any deadlift days. The second area of mobility that I want you guys to start thinking about and start using in your warm-ups and your training is foam rolling or self-myofascial release therapy. Particularly, I want you guys to start thinking about rolling out your IT bands and your quads and your adductor muscles. Your adductor muscles are along the inner thigh. So when our quads, our adductors, and our IT bands along the outside of our leg are tight, it's gonna pull on our knees and put a lot of pressure that we don't want. Particularly if our adductors are tight, let's say, that's gonna pull the knee inward. So what we wanna do is do some foam rolling or lacrosse ball work to help kind of massage those areas and relieve a lot of that tension buildup that we get from performing, like whether we're doing a lot of squats or lunges, leg extensions, leg presses, if we're doing a lot of running. All of these areas are gonna get tight over time if we're not taking the appropriate measures to help them kind of alleviate tension with foam rolling and other active release or self-active release therapy movements. So roll out the IT band. Again, go by feel. The IT band runs from the knee up to the hip, so you want to work that whole area. Certain areas of your IT band are going to feel a little bit tighter than others. So if one area is feeling pretty good, stay in that area. Add some flexion movement with your leg. So rather than rolling it, you're going to bend your leg, kind of flex the knee and extend it, work that flexion and extension. Second area we're going to work on is our quads. The same thing. We could even roll it in towards the inner thigh as well as the VMO. The VMO is the what's called the teardrop muscle. So that runs along towards the front of the knee, and if that's tight, that's going to pull along the front of the knee and create some pressure along the patellar tendon, which runs along the top of the knee. That's a very common issue for people who are lifting, particularly weightlifters and powerlifters. I know from personal experience, I was developing some knee pain when I started Olympic weightlifting. After I started incorporating some foam rolling techniques along my IT band and then my inner groin area, that tension started to go away within a few days. You don't want to wait until you start experiencing pain with this sort of stuff. You want to do maintenance work so you don't acquire that pain ever, and you're able to perform better in and out of the gym. If you are experiencing that pain currently, start troubleshooting areas where you're foam rolling, working on your ankle mobility, as well as activation drills, which is what we're going to talk about now to help fire up those supportive muscle groups and take off the pressure from the knee. The first activation drill we're going to do is called a terminal knee extension, or a TKE. All you're going to do, take a lighter band than the green band that we use from the mobility drills. We don't want to use something that's that high tension yet if this is your first time doing this. Take something that's a little bit lighter, let's say like a red band, feed it through the cable system or squat rack, whatever you have, similar to what you did with the green band. I want this one knee height though. We're going to feed our leg through so the band's looped around the back of our knee. Back up, so again, there's tension created already in the band before you start the drill. You want to basically, whatever knee is in the band, you want to angle that foot outward slightly and just work flexion and extension so you're firing up that VMO muscle group. That's the teardrop muscle along the knee, which is like the quad muscle. That's like the bodybuilding show muscle that we all want when we're training legs. Firing that up is going to help create a lot more support in our knee, and it's going to create a lot less tension buildup when we go on to our workouts. The popular belief for most people is to start off with big movements like squats and deadlifts. and other big movements that require a lot of CNS activation or central nervous system activation. So it might seem counterintuitive to start your workout with smaller movements such as the TKE. 95% of the time that's true if you're doing like a bodybuilding or a classic bodybuilding or a classic strength workout. But if we're experiencing a little bit of discomfort within our knees, we have to make sure that we're activating those supportive muscle groups prior to going into the bigger movements so we're able to perform them optimally and not set ourselves up for risk of injury. The second activation drill we're going to do is what's called a vertical shin step up. So typically when people do step ups, they use a lot of their quads, because what they typically do is they'll shift their weight forward along the center of their foot and push up with the front of their thigh or their quad muscles. The vertical shin step up requires you to completely rely on your hamstrings to pull yourself up to the full standing position. So the reason it's so important to activate your hamstring is just, I've done it myself before doing leg workouts, and your knee just feels much more stable after activating your hamstrings. It just creates like a sturdiness and a stability in your knee that just feels good before you start any leg workouts. So to do the vertical shin step up, find a boxer riser. So when you put your foot up flat, your leg is at about 90 degrees. You want your shin completely vertical, hence the name vertical shin step up. Keep your foot flat. Initiate the movement by pushing your foot down and pretending that you're dragging your foot back towards your body, but without actually moving your foot. You're gonna keep your foot completely still. By doing that, you're gonna feel your hamstring engage almost immediately. So you should feel that hamstring fire up before you even step up. So again, keep that lead foot flat. Pretend that you're dragging it back towards your body without moving it. You should feel that hamstring fire up. Now I want you to keep that shin completely vertical. You can test it by having a partner or someone hold a dowel in front of your knee or a hand in front of their knee and making sure that you're not crossing that path or hitting the dowel or hitting their hand. Depending on if this is your first time doing this or if you have weak hamstrings or inactive hamstrings, you could start with the riser lower than a 90-degree angle, as it's a little bit less challenging to recruit your hamstring fully. This is one of the movements that you want to be very particular with in terms of your form, because it's very easy to cheat and shift your weight forward and use too much quads. You want to rely solely on your hamstring when doing this activation drill. You don't want to do too many reps because you don't want to fatigue yourself and lose form, since form is such a priority with this movement. So I'd recommend backing off in terms of the amount of reps. Do maybe 5 reps each leg for about 3 to 5 sets prior to starting your workout. That way you're maintaining quality of movement throughout all of the sets. All right guys, so that was just a few strategies that you could start using in the gym to help alleviate some of that knee pressure that you might be experiencing. I know it's helped myself personally a lot over the years, as well as a lot of my clients. Again, with something as particular as knee pain, everyone's going to be different, but it's always a good idea to start troubleshooting and trying different ways to help alleviate some of that tension and using some techniques to help create less tension buildup in the muscles around the knee and creating more optimal range of motion in the ankles to help get yourself in more optimal positions. 90% of the time it'll work out. If not, it might be something that's maybe a little bit more specific to you. In that case, I would recommend seeing either a sports therapist, athletic therapist, physiotherapist, someone who could maybe help you get a little bit better of an idea of what's going on. I hope you guys enjoyed the video. If you did, please give it a like. You can subscribe to our channel. We're gonna be releasing new training tips every week. Shoot us a comment down below, ask any questions, and I'd be happy to try to help. Thanks guys, see you next time. Peace.